Welcome back to Mayo Clinic Radio. I'm Dr. Tom Shives.
And I'm Tracy McCrae.
Gastric bypass and other weight loss surgeries make changes to your digestive system to help you lose weight. And they do that really in a couple of ways, by limiting how much you can eat or by reducing what you can absorb, what you do eat. Now, there are several types of weight loss surgery, and collectively they are known as bariatric surgery. The surgeries are done when diet and exercise just haven't worked, but people have usually tried them. Or they're also done if you have serious health complications or serious health problems related to being overweight. But bariatric surgery is not for everybody who's overweight.
It sounds easy, but no, not for everybody. You have to meet certain medical guidelines to qualify for weight loss surgery. It is expensive, and your insurance may or may not cover it. And there are risks for the surgery as well, of course. And after you've lost 100 pounds or more, you still may have to lose heavy folds of skin that are left behind as a reminder of your former self. And that may require more surgery, plastic surgery. Oh, is it all worth it? Well, we know one woman who would answer that question with a resounding yes. She is Jessica Erickson, here to tell her story. And joining us is Mayo Clinic plastic surgeon, Dr. Basel Sharaf. Welcome to the program, both of you.
Thank you.
Thank you.
Jessica, Dr. Sharaf, so good to have you on the program. And Jessica, we can't wait to hear your story. It's been a journey, hasn't it?
It has been quite the journey, yes.
So when were you overweight? When did you first become overweight, or has it been pretty much all your life?
It has been the majority of my life. Basically from 5 to 55 was overweight. It started when I was young. There was a lot of stresses in the household, and the household kind of started using food as a coping mechanism, and I think that that's what started that whole train for me.
Did you try to lose weight over the years?
Yeah, yes, definitely.
It's a good thing I'm in between the two of you right now.
In the household, there was a lot of shame associated with the weight, and so my parents were very instrumental in trying to get me to lose weight as I was growing. You know, we tried every kind of diet you can imagine. Even at the age of 11, my mother put me on a 10-day water fast, thinking that that would help to jumpstart things. So there was a lot of really negative things as well. On my own, I lost 150 pounds multiple times. And whenever something tragic would happen, I would put it back using that fail safe.
When did you decide that you were going to try gastric bypass?
That was a tough decision because for years I kind of had the feeling that that was an easy way out, and I didn't want to do that. And then one day, it was January of 2016, and I was sitting at my son's basketball tournament. Actually, I was standing there. We had come in. It was a really crummy Minnesota day, icy, cold, and went into the gymnasium area and the outer hall where we had to wait and no place to sit. And at that point, I couldn't stand for more than 5 minutes. So looking for a place to sit was imperative for me, and I really had two choices. I could go back to my car, run the car, and sit there, or I could manage to sit down on the tile, which was pretty humiliating in its own way. And so that's the option I did. And while I was sitting there, it just came upon me, and I just realized I have allowed weight to take over and isolate me.
You said you lost 150 pounds multiple times. How overweight were you?
My highest documented weight is 413 and a half pounds. I know I was higher than that, but that's record. Because before that, I wouldn't weigh. I refused.
We wouldn't have asked you then how much you weighed, but we can ask you now. 413. And the question, were your parents overweight and your siblings?
No.
Really?
My older brother and younger brother struggle with it, and there are relatives in the family that are. Both of my parents were in the military. My mother was the Air Force and my dad was Army, and so there was a fitness background for them. So, no.
So you decided to go gastric bypass, and when did you do that?
In October of 2016 is when I actually had my bariatric procedure.
But there's stuff leading into it.
It did. I mean, that day, the Monday following the weekend when I came to the decision I had to do something, I went in and immediately called Jen Radke and said, you know what, I know you're in administration today, but we've got to talk. And we set up a time that I could go in, and we started documenting everything. And she said, enough's enough. It's time to send you to Rochester. And so I came down here and met with the endocrinologist.
Hormone doctor. Yeah.
Exactly. Dr. Kurt Kennel. And he's an amazing, very genuine person and very honest. And we talked about what my options were. And the vertical sleeve gastrectomy, which is the most common one that people do nowadays, was not an option for me with that high of a weight. And so we had to kind of look towards the duodenal switch, which just scared the daylights out of me. I was not excited about this and told him that, and that I was more than likely not going to do that. And we agreed that I would go through the classes, and as I would go through the classes, I would decide.
Yeah, unfortunately, it's a little more complicated procedure.
A very, very complicated procedure.
By the time then you got to surgery day, how much did you weigh at that point?
Okay, so I started at 413 and a half. A surgery day, I was 337 and a half, because I had made a decision that if I was going to have surgery, I was going to take every ounce of energy I had and every bit of knowledge I could assimilate and use that to create the lifestyle that I was going to need to have afterwards. And if I didn't feel like I could do that, then I would not be capable of sustaining the life I needed afterwards, and I was going to put myself at risk with that type of malabsorption. So I really did a whole transformation of everything at that point. So I was 337 and a half on that day. By the time I made it to plastic surgery with Dr. Sharaf, I was 172 pounds. Wow. So I had dropped quite a bit over the course of time. And I think I consulted with Dr. Sharaf right before I hit my lowest weight, and that was in November of 2017. So over the course of 2016 to 2017, I had lost this huge amount of weight.
And why did she come see you, Dr. Sharaf?
Yeah, was her story typical?
Actually, quite typical. Many patients struggle with this all their lives, and Jessica lost so much weight, and she was very motivated. She was ready to make the change, and a lot of times once patients lose that weight, we'd like them to be stable for a minimum of 3 to 6 months. There may be a plateau phase where they may be at the end of their losing phase, but then sometimes they may gain a little bit of weight. So we really like to see a stable weight for at least 3 to 6 months before we make any changes in terms of body contouring. And make sure that they're healthy, that they're not on a malabsorptive phase, that their labs are fine, nutritional labs are okay. So emphasizing the multidisciplinary approach. We have a great team here, and once we check all of these things off, then we talk about body contouring. And there are usually many reasons patients seek that.
And why Jessica? What did you go in for?
At your highest weight, you have an image of yourself, and as you're losing weight, that image is very slow to change. A lot of us are stuck with body dysmorphia, so we don't see ourselves as everybody else sees us. We still see ourselves much larger. At a certain point in that journey, I realized that every time that I did lose weight, I was stuck with the remnants of that previous self. And it was a constant reminder that it was there and it could come back. And I had worked so hard at taking this weight off. I had decided as I was going into the surgery that I was going to transform my life. And I was choosing this huge procedure as a way of doing it, and I was going to be successful, and I was not going to fail. And so as that was occurring, and as I was becoming leaner, I was seeing the remnants still there, and that was not acceptable to me. It was like I didn't know what I was going to have to do to get the money to do this, because it's very expensive, but I was not going to continue that way. I was changing my life, and I was going to go back. And basically the whole thought process was that I wanted to not change my body or my anatomy. I wanted to restore my anatomy. And that's what Dr. Sharaf really, I think of him as doing, is he's returning me to who I should have been to start with.
All right, we want to hear the story about the plastic surgery. We need to take a short break. We are with Jessica Erickson, who has recently had bariatric surgery, and it was extremely successful, and Dr. Basel Sharaf, plastic surgeon. Time for a short break. When we come back, we'll talk more about the plastic surgery. Welcome back to Mayo Clinic Radio. I'm Dr. Tom Shives.
And I'm Tracy McCrae.
We are with Jessica Erickson, who has had bariatric surgery about 2 years ago. Was it, Jessica?
Yes.
We've learned about the surgery, the amount of weight that she lost. So you went from a maximum of 413 and a half down to, what were you at your lowest?
My lowest weight was about 165 and a half or so.
And you're still pretty close to that, right?
A little bit. I mean, I have about a 10-pound range that I allow myself to fluctuate in.
I was going to say, be careful there, mister.
Yeah.
Be careful.
And Dr. Basel Sharaf, plastic surgeon. So you were talking about how you felt after the surgery, and you still had these remnants of being the 400-pound person you once were. And what was it that bothered you the most? What was specifically did you go to see Dr. Sharaf about?
Well, when you have that type of situation, you have all this excess skin, you wind up with rashes, blisters, all kinds of really kind of crummy things to live with on a day-to-day basis. And so not only do you have the hiding and the shame that you had, the shame that I had and was shamed for as a child, was still there because I was shaming myself. Because every time I saw myself, I had to think in terms of, how do I hide this? You know? So I didn't want that. I wanted to be genuine about who I was, and I didn't want to live that type of life, and I definitely wanted to get rid of the medical complications.
I would say it's probably a little bit more complicated, Dr. Sharaf, than cutting away excess skin, body contouring. What is it that you do for patients that is more, I don't know, dedicated and delicate?
This field really sort of evolved tremendously over the past 20 to 30 years. And with the advances in bariatric surgery, so did post-bariatric body contouring. So very commonly, I see patients for, like Jessica mentioned, chronic rashes, especially during the summertime, excess moisture under the abdominal skin, or sometimes under the arms, sometimes under the breast. You know, the body really undergoes a 360 degree change. And
so the skin doesn't really shrink. It just becomes very redundant when you lose the underlying fat.
For the most part, it does. You know, younger patients who go through this journey at a younger age may have some skin retraction. So the amount of laxity they may have is not as much, but especially with pregnancies and significant weight gain, the majority of the skin stays there afterwards, and it really becomes a burden on the patient's sort of well-being and health. Usually these patients are very motivated to do more sports, and you can imagine it's pretty hard to be engaged in doing more sports and staying active. The whole purpose of doing the bariatric surgery, when you're carrying around 15, 20-pound abdominal skin excess, or under the arms, or the breast being too heavy. So the body image is a component of this, but also really the overall health of the patient, their positive sort of body image, and really staying healthy is a big component of it.
How many surgeries does it take to do this for a typical patient?
So
you're both smiling.
How many did it take for you?
It's not a one and done.
Well, that's what, yeah, I figure.
And for me, I had the paniculectomy with fleur-de-lis. That took care of
this. It's a paniculectomy. So
okay, you got to help me out.
That's the lower abdominal skin.
Okay, so the skin, and it was redundant.
Yes.
And it obviously didn't like the way it looked.
Yeah, that among other things.
Okay, so
causing problems.
Yeah. Okay, that was the first thing you had done. And how do you fix that, Dr. Sharaf?
So typically the skin excess, patients get a skin-on-skin sort of contact, which can cause a lot of rashes, sometimes skin breakdown. We've had patients who've had actually serious infections and had to be hospitalized for it as well, for severe cellulitis. So we want to make sure there's no active infection. We really try to sort of advise them about skincare, but usually it's really a surgical problem because there's so much you can do to take care of your skin if you have a lot of skin excess. So we evaluate the patients. We address their areas of main concern first. So typically the abdomen is the number one problem for most patients. So we look at how much excess there is. Is it mostly confined to the anterior abdomen, or it is circumferential, goes around the entire abdomen and the back area? And depending on that, then we decide, are we going to proceed with just a paniculectomy, which is removal of the excess abdominal skin, or combining that with an abdominoplasty, or extending the paniculectomy to
abdominoplasty?
Correct, which is an additional cosmetic procedure depending on the wishes of the patient, what they would like to achieve out of the procedure. But the paniculectomy is really typically a medically indicated procedure to improve the skin rashes, their dependency on those medications that they have to apply, and to avoid further skin breakdown and infections. If the skin extends further circumferentially, we typically combine that with a posterior lipectomy. And
okay, so the paniculectomy is where you remove the skin and the fat, the excess. And abdominoplasty is where you give them a six-pack, or what's the abdominoplasty?
The abdominoplasty is really extending the paniculectomy a step further and removing a little bit more skin, but also toning their abdominal wall. Usually there is some diastasis of the abdominal muscles. We call it diastasis recti. We would bring that together by plication, and then really reshape the abdomen to have a more pleasing outcome.
All right, so we've got the abdomen taken care of. What was next?
Well, we also did the breast at the same time.
Okay. And then arms? Have those done also?
Yes, we just finished that. That was back here in March. We did the brachioplasty and torsoplasty.
So brachioplasty refers to the arms. So you had the excess skin and fatty tissue removed from the arms.
Yes.
And then what was the other thing you mentioned?
A torsoplasty.
Torsoplasty. And that is, Dr. Sharaf?
So, we think about weight loss as a 360 problem, and a lot of times when you lose that weight, you think about a circumferential really skin excess. Oftentimes it could be some skin excess just beneath the armpits, size of the breast, and sort of in confluence with the underarms. So we call that a torsoplasty, right? Reshaping of the lateral trunk. Sometimes we combine that with the brachioplasty or the breast, depending on how we're staging the procedures.
And you're all done, aren't you?
Probably not.
What's left?
I can't imagine.
Well, I have thoughts. Well, no, I do. I think we're going to talk about a revision and just take a little bit more off my abdomen.
Well, you look
this
fabulous.
Chin bothers me and stuff like that. So, there are thoughts.
All right. Well, we are out of time,
story.
but tell us, what would you suggest to someone who is considering this for themselves? Both gastric bypass and the contouring.
That the journey is not an easy one on either of the processes, bariatric or plastics. Bariatrics, I think a lot of people think in terms of you do it and it's fixed you, and it's not. It's a lifelong commitment after that. Plastics is more, the struggle with plastics was more of, there's a certain intimacy in that situation because you're in a room with people who are the first time I saw this guy, he walked in and told me to take off my clothes, right? and there was a room full of people, and I don't know that many people had ever seen me naked, even when I was a baby, So suddenly you're exposed, and all of these areas that were very shameful to you are now things that you're dealing with, but you're having to emotionally deal with them as well. So I think it's a very emotional process. It's extremely rewarding. It's painful at times, but it's definitely worth it.
All right, bariatric surgery patient Jessica Erickson, thanks so much for sharing your story with us. Dr. Sharaf, thank you so much for everything that you did for Jessica. She's obviously happy with the result, and she looks fabulous.
Thank you.
Thank you for having us.
Thanks to both of you.
Thank you.